Hey, we are the Lab Doctors. I'm Amanda.
I'm Dorothy.
And I'm Zhao Yong.
We are biomedical researchers who realized we still have a lot to learn about science.
So why not join us on this quest?
Hey everyone, welcome back to the Lab Doctors podcast. So on this week's episode, we're going to be talking about...
Your tonsils, tonsilloliths and tonsillitis.
Okay,
So tonsils are small oval-shaped bits of tissue at the back of your throat, and it's not a very smooth shape. So you have one on each side. Each tonsil is made up of a mass of soft tissue and is covered by a layer of mucus-producing cells known as mucosa. So your tonsils are part of the immune system. They produce white blood cells to help fight infections. And it actually helps to filter the bacteria and viruses that enter the body through the mouth. Okay, so Tonsilloliths.
how do you spell it?
Tonsilloliths. These are known as tonsil stones.
That sounds so painful.
Yeah.
Okay, so I guess none of y'all have tonsil stones.
No.
Nope.
Okay, because I have. That's why I'm like,
Oh my God.
I researched on this topic.
Okay, so one is tonsil stones and one is just inflammation of tonsil.
Yes, correct. So tonsil stones or tonsilloliths are small lumps of hard material that form in your tonsils. They are white to yellowish color. So you have never seen a tonsil stone before, right?
No.
So last time when I don't know what is tonsil stones, right? Once in a very blue moon, I'll feel that something is in my throat and then I will gag it out. And then it either comes out fully and then I'll be like, oh, there's this white stone thing. Or like I would swallow it into my stomach.
Like it's solid.
Yeah, and it's ultra smelly.
Oh.
So how do tonsil stones form? Basically your tonsils, right, they are made up of folds, gaps and crevices called tonsillar crypts. Tonsillar space crypts. So these are naturally occurring pockets or folds in the tonsils made up of soft tissue. An average adult has 10 to 20 crypts. Those who have more tonsillar crypts are more likely to get tonsil stones. So with these crypts, they can trap bacteria, dead cells, food debris, mucus, etc. in these crevices. And then when this debris calcify, then they form this thing called tonsil stones. So actually the tonsil stones, well, they're called stones, right? I don't think, personally, from experience, they're not like hard like a stone. If you squash them, then it's like just calcium milk.
Oh, it was brittle.
Yeah.
Not brittle, it's like mushy. Okay, back to the tonsil stones. So how do I know if I have tonsil stones? Bad breath is one of the main symptoms, especially I think if you got a lot or like the very big ones. If you feel something stuck in your throat, so that's when like it actually comes out or is dislodged. Then for the more severe ones, pain when swallowing, chronic sore throat, and even ear pain. So this one, like, I don't experience now, these more severe ones. And apparently for the ear pain, it's because like tonsil stones can develop anywhere in your tonsils, right? And because of the shared nerve pathways, people might feel pain in their ears, even though the stone isn't actually touching your ear at all. And that just sounds very unfortunate. So the treatment for tonsil stones, actually some tonsil stones are so small and so well hidden that only imaging tests such as CT scans or MRI scans can find them. And this one I also don't know because like usually tonsil stones are the ones I can see. But can you imagine 10 to 20 crevices? Obviously you can't see them from just your mouth. So there's probably like a lot deep inside.
Okay.
Yeah, so usually no treatment is needed for tonsil stones. The big ones might just get dislodged without you knowing also. But if they bug you, you can first try some home remedies. So firstly, you can remove your own tonsil stones by scraping gently with water picks or swabs.
Oh, not what I expected. Okay.
I would not classify water picks as gentle.
Yes, I agree. So the background is like we all bought like a water pick. The jet is so strong that it makes your gum bleed like the first few times you use it.
After
No,
that,
but it's
gum.
because your gums are weak. It's not because of the water fake,
Yeah.
right?
Yeah, but the thing is the water pressure is that strong also. I can't imagine like
Spraying it at soft tissue.
yeah. Okay, so if you do that, just make sure the swabs are very clean. And last time I actually watched, it's very disgusting, but I watched videos of people removing their tonsil stones, and these are usually the very severe, very big ones. And it's amazing how they do it because like I tried myself before. For those that, it's not super big, like mine's not very serious, but like when I have it, you just want to get it out. From my experience, when you do it, like if you stick something into your throat, right, you will usually gag,
Yes.
right?
Yeah.
Yeah, so I don't know how the people do it in the videos. Maybe they do it so often they can control. And if not, your tongue will be blocking you. Like, you just imagine you open your mouth. Usually your tongue is like there, blocking the root. You have to say like so that your tongue goes down.
Yeah.
Yeah, so other than gagging, as in when you gag, then your body naturally also produce a lot of thick saliva, mucousy saliva.
Yes.
So then it just gets very messy and uncomfortable. So the other method is saltwater gargles. Gargling with warm salty water can help ease the pain of tonsillitis, which we'll go into it later, and it can help in the removal of tonsil stones. But usually, like, I never gargled salt water before, but like when you gargle, I feel like it never goes that deep.
Yeah, I get what you mean.
Yeah.
You must really like open your jaw, open your mouth, like hit
Yeah,
back.
so usually gargling doesn't really help. And lastly, it will be good dental habits that can help to remove bacteria and stuff from getting your tonsils. So like gargling after eating can also prevent food buildup in your mouth and then likelihood of food getting trapped in the crevices. However, if your tonsil stones are very, very large and causing like serious problems, there are more professional treatments that can be done. So number one is surgical removal of your tonsils called tonsillectomy. So if your tonsil stones are a long-term problem, you might want to have your tonsils taken out. Then there's this thing called cryptolysis. Can you guess from the name?
It lyses
the crypts.
Okay, yes. So this uses a laser or radio frequency wand to scar your tonsils, and this will help to make the formation of tonsil stones less likely.
Right.
Yeah, and maybe like for someone who's more prone to tonsil stones, there's just more of these crevices and
so
crypts.
It's fine if you burn somehow.
Yeah, just burn them all.
Tricaris.
And lastly is antibiotics. So medications can help, but they have side effects and they don't actually fix what is causing these tonsil stones. So antibiotics are usually more like to help if there is a bacterial buildup in your tonsils, and then these bacteria can also be contributing to bad breath, and it can also kill off any inflammation that comes with the tonsil stones. So this is where tonsillitis can come in as well. So tonsil stones can cause tonsillitis, but it's not the main cause of tonsillitis, which we'll go into later.
Okay.
And so how this bacteria thing in your tonsils come about is like the crypts have low oxygen levels, and therefore the bacteria that don't need oxygen can start to grow in these crypts, and they can lead to an infection. Okay, so that's about tonsilloliths. Then, the second half of this episode, we are going to go into tonsillitis.
Okay.
So yes, anything that ends with itis is inflammation of whatever the word is in front of it. So we mentioned that the tonsils are part of the immune system, producing white blood cells to fight infections such as those from the bacteria and viruses. However, we can say that our tonsils are noobs as well, because they are also vulnerable to these pathogens when the tonsils get inflamed. So how do you tell if you get tonsillitis? Have you gotten tonsillitis before?
No,
Don't think so.
but I'm assuming pain.
Oh, like lucky people.
But I think maybe like sore throats or something.
Yeah, that's what I was thinking. Like, I probably have, but I don't know that it's tonsillitis.
Yeah, it's like it's swollen or something, especially
Yes.
the very painful ones near the top whenever it hurts when you swallow. I think that's probably tonsil, right? But they
Yes.
just call it sore throat.
Okay, you are very lucky because it's way more than a sore throat.
Oh, okay.
Oh,
Oh,
okay.
okay.
It's so bad.
Okay. It's because you are the fortunate one with many, many crypts.
At least I'm more fortunate that it's like not too serious. So how do you tell if it's tonsillitis? Your tonsils, which are at the side of your throat, will look red and inflamed. Yes, you'll feel like you're having a very bad sore throat, and this is usually accompanied by fever and headaches. So I remember when I had tonsillitis, I had like high fever, like 38 or 39. Okay, maybe I don't think it reached 39, 38 point something.
Whoa. It's still.
It's
Yeah.
very uncomfortable. And then your jaw and your neck will appear tender from the swollen neighboring lymph nodes. So the symptoms are very different depending on what kind of tonsillitis you get. So it can be bacteria or virus-induced tonsillitis. So if you go and Google image, they show you the difference between the bacteria and virus. And this is important, especially for doctors when they diagnose it, so that they give you the proper treatment. So if you have viral tonsillitis, it probably looks better than a bacterial one. So viral, it usually stops at redness and swollen tonsils. However, in bacterial infection, additionally, you will observe that the uvula, which is your little punching bag, gets swollen. And you'll get these whitish or yellowish spots appearing in your tonsils.
So like pus, is it?
No, I think in very severe cases it might be pus, but usually it's like tonsil stones.
Okay.
I guess because it's like bacteria, and then maybe plus the swelling can...
Trap it more.
And of course... And you also get a grey furry tongue, whatever that means. Like just like there will be a layer on your tongue. So for viral tonsillitis, it's commonly caused by the common cold, also HIV, hepatitis A, rhinovirus, and Epstein-Barr virus. Whereas for bacteria, it's most commonly caused by streptococcus kind of bacteria. So basically my tonsillitis was bacterial tonsillitis, and then they just give me a dose of antibiotics that you have to finish.
Help?
Yeah, it helps. It's super good. It's like you take the antibiotics, then the next day you can eat. Okay, so for treatment, yes, bacteria, you will give a full course of antibiotics. And this is why it's important because why?
Because of antibiotic resistance from misuse of antibiotics.
Correct. Whereas for viral induced tonsillitis, usually no treatment is required. They'll just give like fever medication, lozenges, things that help to
ease the symptoms but not deal with the cause.
Yeah. So usually when one gets tonsillitis, it's once in a blue moon. It's known as an acute infection. However, some people are more prone to tonsillitis and they can get it multiple times a year.
Oh no.
Yes, and it's just so debilitating. It's like you just get a random high fever and it's so uncomfortable. So different websites give different frequency on what is like the threshold of a serious tonsillitis. Healthline said that it's 1 to 7 times a year, or more than 5 each in 2 years, or more than 3 each in 3 years. So depending on how frequent it is, your doctor might classify it as chronic tonsillitis. And chronic tonsillitis can cause tonsil stones, and in that case, one may opt for tonsillectomy, which is the removal of your tonsils. So based on research so far, there's currently no significant effects of tonsil removal on the overall immunity of the person. Yeah, so I mean, at that stage, it sounds just more like a hassle, the number of times you get an infection.
Like your risk of getting infection is worse with it, then might as well remove it.
Yeah.
True.
So tonsillitis is not really contagious, but it's possible, and the infectious organisms can be passed on to other people like coughing or sneezing. So if you get tonsillitis, you should also be careful lah.
Wear a mask.
Oh,
Will it help?
Okay.
I guess
Probably, if you're a mouth breather.
Which we all are.
Huh, really?
Yeah, I always complain about our mouth breathing.
But we breathe mainly through the nose, what?
No, as in
I
like,
think when we speak, is it through the mouth?
I don't know.
Oh, yeah, when we give presentation, I'll be like,
Yeah. And when we laugh also, I just noticed when I laugh, I was like, oh wait, I'm breathing through my mouth. I'm a mouth breather.
Is that the end?
yeah, that's the end.
Oh.
So that's all for the difference between tonsilloliths and tonsillitis.
And as usual, subscribe to our YouTube channel and follow us on Spotify. A like and a comment would really help us out.
You can also follow us on our social media, Instagram, Twitter, or Facebook, and feel free to DM us any questions.
Alternatively, you can email us at thelabdoctors@gmail.com. We'll post the links in the episode description so you can check that out. Thank you.